Hello, everybody. My name is Tony Lajeunesse, President and CEO of TL Financial Group. Thank you so much for attending today's webinar regarding Medicare and managing your healthcare expenses in retirement. This is a really important topic, especially if you're nearing that magic age of 65 and need to make decisions regarding your healthcare. And if you're already on Medicare, then today's webinar is going to provide you with a refresher and update you on some recent changes that have happened with Medicare. Before we dive too far into our topic today, I do want to share a little bit about myself and TL Financial Group if you're not currently a client at TL Financial Group. Again, my name is Tony Lajeunesse. I'm the President and CEO of TL Financial Group. TL Financial Group is an independent holistic financial planning firm with 8 team members. Each has their own specialty to serve our individual client needs. Our focus is delivering excellent education and customized financial advice to those of whom we serve. Every family member and individual has their own unique set of circumstances, and that requires a customized approach to their needs. So our focus surrounds the bullet points that you see here on the screen. I've been serving our clients for about 20 years. When providing investment advice, I am an accredited investment fiduciary, placing my clients' interests first and providing objective, customized advice. We are primarily a fee-based financial planning firm, which means that we charge a flat fee percentage for our services. And we're independent. We don't work for a firm where we have to peddle the company's products and services. We can fully exercise our fiduciary obligation to our advisory clients and provide what they need. And this is our main goal, to place you first by providing a customized plan that is relevant to you. Our team is located in Southgate, Michigan. Our office is located on Reek Road, just behind the YMCA off of Northline Road. However, due to COVID, we've been working remotely and using video and phone conferencing with our clients, which is proving to be an efficient process. So let's touch a little bit on the bullet points of our core services because they really are important. We provide a holistic planning approach, as I mentioned, to our clients' needs and objectives. And this approach includes tax planning, where we help provide tax guidance through the different stages of your economic life. We also provide estate planning guidance, where we coordinate your estate planning documents and provide guidance that is relevant to you and your situation. Very importantly, we help provide the proper guidance for the titling of your accounts and making sure you have the correct beneficiary designations. On the investment planning side, because we're independent, we pretty much have the investment universe available to us and to our clients. So we're not beholden to certain investments or products. We like this, and so do our clients, since we're able to exercise our fiduciary obligation by providing objective investment advice. And then there's cash flow planning. This is so important. Cash flow planning is at the core of what we do for our clients. And unfortunately, in our experience, most have not had this type of planning provided to them. Cash flow planning takes into account your Social Security options, your pensions, investments, retirement accounts, Medicare expenses, taxes, life insurance, everything. And what it does is it looks at each year and provides you with a clear vision of what your income is going to look like. So for example, if you and your spouse are going to retire next year, then we need to examine all of these options as it pertains to you. Should you take Social Security at 62, or should you wait until your full retirement age at 66? Should your spouse collect on their own benefit or yours? We need to know that before we make that election. Which pension option, if you're fortunate enough to have one, should you take? We want to make sure that we examine all of these options. Do you take the lump sum? Or do you take the annuity option? Do you plan on taking distributions from your 401k or IRAs? What are the tax ramifications of that? So if I plan on retiring in 5 years, am I on track for that? What if my spouse passes away unexpectedly? Am I going to be okay? All these questions are answered in the cash flow analysis. It provides a clear expectation based on different scenarios so that you have a clear understanding of what to anticipate. We're so passionate about this type of planning and truly believe that this type of planning is necessary to help you make an informed decision that is relevant to you. It's customized. Again, each of you have different circumstances that require this customized approach. And that's what cash flow planning accomplishes. It sets expectations and provides clarity and confidence. Okay, now that you know more about me and our firm and what we do, let's get into today's presentation on Medicare and managing your healthcare expenses in retirement. Today's webinar is in listen-only mode. The presentation is being recorded and will be available on our website and our Facebook page. So if you have any questions for me, as always, please email me or call me at the office to set up some time with me. All right, let's go ahead and get started. So we're going to cover a lot of information over this next hour. If nothing else, I hope you come away from this presentation understanding 3 key points. The first key point is that if you do not enroll in Medicare on time, you will pay a monthly penalty. A lot of baby boomers don't know if or when they are supposed to enroll in Medicare, but there are very clear rules about when you have to sign up. If you don't sign up within a specified window, you'll be assessed a monthly penalty that you'll have to pay for the rest of your life. The second key point is that if you do not get the right private insurance to go with Medicare, you may end up paying too much in premiums and out-of-pocket costs. Now, the fact that you even need private insurance to go with Medicare is a surprise to many people. Some people think Medicare covers everything, but no. In order to have prescription drug coverage and coverage for other out-of-pocket expenses, you need to have private insurance, which I'll show you in just a moment on how that works. The third key point is that if you do not plan for higher healthcare costs in retirement, you could run out of money or not be able to get the care that you need. People are usually happy to go on to Medicare when they turn 65 because it provides some relief against the high health insurance premiums that we see today. But you must be prepared to factor higher future healthcare costs into your retirement budget. And the best time to do that is now. You'll see what I mean in just a little later on in this presentation. Now, today's presentation will be divided into these 3 parts. In part 1, we'll be talking about Medicare, what it is, who needs to enroll in Medicare, and when, and how do you enroll in Medicare. In part 2, we'll be discussing the private insurance that goes with Medicare. To understand the public-private partnership, that is Medicare, we'll be talking about how much Medicare costs and what it covers. More importantly, what it doesn't cover and how private insurance integrates with Medicare. And in the third part, we'll talk about how to plan for higher healthcare costs in retirement. There are 2 reasons why our healthcare expenses will be higher in the future. One reason is inflation, and the other is the increased need for healthcare services as we go. One expense that needs to be planned for is long-term care. Some of you may have had the experience with a parent or other relative needing help with activities of daily living, such as bathing and dressing, or even just keeping up with housework and preparing meals. Many people are surprised to find out that the cost of these services are not covered by Medicare. 35% of you who took our Medicare survey before today's webinar believe that Medicare pays your long-term care related illnesses indefinitely, and that's not true. We're going to review the specifics later on. All right, let's start this education session by talking about Medicare enrollment. How does this work? Who pays for healthcare in the United States today? Well, if you're under 65, your health insurance is usually work-based, right? If you're still working, your employer probably provides health insurance. If you're retired, you might have a retiree plan, or maybe you recently left your job and have extended your employer coverage at your own expense under COBRA. Maybe you've purchased your own individual health insurance policy. After age 65, Medicare generally pays first. That is, our health insurance system is set up so that once a person becomes eligible for Medicare at 65, most private insurance becomes secondary to Medicare. So when you incur a healthcare expense, the bill is submitted first to Medicare. After Medicare pays what it's going to pay, any other insurance you have may pay some or all of the rest. The only exception is employer group plans that cover 20 or more employees. So if you're still working and covered by such a plan, or if you're covered as a spouse under such a plan, your employer plan will pay first. This has implications for enrollment as we'll see in just a moment. Now, what this means is that unless you are covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. So what if you don't enroll in Medicare on time? The consequences are pretty dire. First, you'll be charged a late enrollment penalty, and the longer you go without enrolling, the higher that penalty is going to be, and it will continue for the rest of your life. I was really impressed to know that those who took the Medicare survey before our webinar, that over 80% of you were aware of this penalty. That's really encouraging to know, since you don't want to pay this penalty. The second consequence is that your healthcare expenses may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. If you have other insurance, it will not pay its share until Medicare pays its share. So if you don't have Medicare, you could end up getting stuck for the whole bill. And then finally, your private insurance options may be limited. If you're in poor health or have a pre-existing condition, the private insurers that coordinate with Medicare have to take you if you sign up for Medicare during your enrollment period. But if you don't, and you go to apply for private insurance later, you may not be able to get insurance, or you may be charged a higher premium. All right, let's back up a little bit and ask, what is Medicare? Well, it's a national health insurance program for people over 65. It was signed into law in 1965 by President Johnson. It's administered by the Centers for Medicare and Medicaid Services, and enrollment is actually handled through the Social Security Administration. Everyone over 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the U.S. continuously for at least 5 years. Some people under 65 can get Medicare if they receive Social Security disability benefits, but our discussion today will really pertain to just the first group, which is people over 65. All right, Medicare is divided into 4 parts. Part A covers part of the cost of hospitalizations. Part B covers part of the cost of medical services, such as doctor visits, procedures, and diagnostic tests. The bills for Part A and B are paid by Medicare. Part C and D are where the private insurance comes in. Part C is an alternative way to get Medicare. So you can sign up for Medicare. You can sign up for a Medicare Advantage plan offered by a private insurer and get all of your services under Parts A and B, and usually prescription drug coverage as well through that plan. Instead of Medicare paying for your hospital and doctor bills, it pays the insurance company offering the Medicare Advantage plan a flat payment for each enrollee. Then the plan is responsible for managing and coordinating your care. Part D is the prescription drug coverage. It is offered by private insurers who contract with Medicare. So each prescription drug plan is slightly different, which is why you'll want to shop carefully for your drug plan. Even if you don't take any prescription drugs, when you first go onto Medicare, you're going to want to sign up for a Part D drug plan, because if you go without drug coverage for very long, you'll face a penalty when you finally do enroll. Now, this image that you see here shows 2 ways to have Medicare. If you go with original Medicare, you sign up for Parts A and B, then you decide if you want a prescription drug coverage under Part D. This shows drug coverage as optional, but it can be dangerous to go without drug coverage. So we're recommending that everyone plan to have some type of prescription drug coverage starting from the outset of Medicare. Now in step 3, you decide if you want supplemental coverage. Again, Medicare shows this as optional, but we think it's pretty important because Medicare leaves too many gaps. The second way to get Medicare is through a Medicare Advantage plan offered by a private insurance company. Now, there are many companies in this area offering Medicare Advantage plans, so if you go this route, it will be important to shop for plans and find one that meets your needs. And again, drug coverage is shown as optional, but we highly recommend that you choose a Medicare Advantage plan that offers prescription drug coverage. Choosing how you take Medicare is a really big decision. It needs to be individualized, and we can't go into depth here today, but we can get you around the pitfalls though. However, I do want to mention that our Medicare survey revealed that 62% of you who responded would select the traditional Medicare program, while only 7% of you would choose Medicare Advantage plan, and about 31% of you are undecided. So I hope this webinar helps you feel confident regarding the choice that you make. It helps educate you so you feel more comfortable and confident of the decision that you're going to make when it comes to Medicare. So if you're receiving Social Security when you turn 65, you're going to be automatically enrolled in Parts A and B. If you're working and covered by an employer group plan, you may not want Part B. In that case, you can decline it. Otherwise, you'll go ahead and accept Medicare Parts A and B, and your coverage will start on the first day of the month that you turn 65. Parts C and D are not automatic. So if you want a Medicare Advantage plan, you'll have to contact the insurance company offering it and sign up for Part C through them. Or if you want to stay with original Medicare and have a standalone Part D prescription drug plan, you'll need to decide which insurance company's plan you want to go with, and you'll have to proactively enroll. You should do this at the same time you are enrolled in Parts A and B before your 65th birthday. Now, what if you're not receiving Social Security when you turn 65? More and more people are continuing to work, or at least delaying the start of Social Security in order to receive a higher benefit. In this case, you'll need to proactively enroll in Medicare during a Medicare enrollment period. There are three main Medicare enrollment periods. The initial enrollment period applies if you are not covered by a group plan that covers 20 or more employees when you turn 65. So if you are covered by an employer group plan, because you or your spouse is still working, you have a special enrollment period, which I'll explain in just a moment. So if you miss either one of these enrollment periods, you can sign up for Medicare during what's called the general enrollment period. The initial enrollment period for people who aren't covered by a group plan at 65 starts 3 months before you turn 65 and lasts until 3 months after you turn 65. But although it lasts a total of 7 months, you really should plan to enroll in Medicare during the 3-month period before you turn 65. Then your Medicare coverage will start on the first day of the month that you turn 65. And by the way, if your birthday happens to be on the first day of the month, everything is moved up a month, okay? Just pretend your birthday is in the previous month. For example, if your birthday is June 1st, your initial enrollment period would start February 1st. If you sign up during February, March, or April, your coverage would begin May 1st. Now, we've been talking about signing up for Medicare as a whole, but there are times when we need to break it into parts. Most people will sign up for everything all at once, but there may be times when you want to sign up for some parts and not others. If you're still working when you turn 65, check with your benefits administrator to see if you should sign up for Part A. We mentioned earlier that if you are covered by an employer group plan when you turn 65, you have a special enrollment period that ends up coming later on. However, you may want to sign up for Part A when you first become eligible at 65. The reason is that it may offer better coverage for hospitalization than your employer group plan. And Part A is usually free to you, but check with your benefits administrator anyway, just to confirm. If your employer group plan is a high deductible health plan paired with a health savings account, and if you want to keep contributing to the health savings account, you should not sign up for Part A. The reason is that once you enroll in Medicare, your health savings account contributions must stop. But let me be clear, if you have an HSA and your employer plan covers fewer than 20 employees, you will have to drop the HSA and sign up for Medicare during your initial enrollment period at age 65. Now, if you are not covered by an employer group plan when you turn 65, you will want to sign up for Part B during your initial enrollment period, preferably that 3-month period before your 65th birthday. So if you're not working If you're self-employed, if you're employed by a company that has fewer than 20 employees, if you're on COBRA, even if you're receiving retiree health benefits, you'll want to sign up for Parts A and B during your initial enrollment period. If you signed up for Parts A and B during your initial enrollment period, and if you think you will ever in your life want prescription drug coverage, you should enroll in Part D at the same time. If you go more than 63 days without credible prescription drug coverage, you will pay a late enrollment penalty when you finally do sign up for Part D. So it's better to just go ahead, get your drug coverage from the onset, even if you aren't currently taking any prescription drugs. As mentioned before, you've got two options. You can enroll in a standalone prescription drug plan if you have original Medicare, or you can get your drug coverage through a Medicare Advantage plan. If you're already on Medicare and have an Advantage plan, then you are probably getting a flurry of marketing pieces in your mailboxes. Open enrollment starts October 15th and extends through December 7th. This is the time that people can change their plans for the upcoming year. I want to share with you with what one of my colleagues shared with me regarding her drug plan premium. And this is what she writes. Tony, my drug plan premium is more than doubling from $14.20 to $32.50. They're hoping I won't notice. The company changed its name from Envision to Elixir, and the plan I have is called RX Secure. When I go to the Medicare Plan Finder, which you can find on Medicare.gov, it's on your screen right there, and review all the plans in my area, I see that there is another Elixir plan called RX Plus with a premium of $14.30. So this is what these drug insurers do. They jack up the premium on the plan you have and then introduce a new plan at a lower premium to attract new people. This has happened to this person more than once. It's why your clients need to be vigilant about reviewing their plans and be prepared to change every year if necessary. Since I don't take drugs on a regular basis, this person says, I choose the plan with the lowest premium. Thank goodness Medicare makes it easy to compare these plans. There's another plan offered by Aetna for just $6.30 per month. I think I'll sign up for that one. So this is really important to keep an eye on your Part D prescription plans and the premiums that you're paying. Make sure they're not jacking them up on you and you're researching this. You can compare your plans at Medicare.gov, and it's a pretty nice system to work through. Hope that's helpful. Okay, that takes care of the initial enrollment period. Now we're going to talk about the special enrollment period. This is for people who were covered by an employer group plan that covers 20 or more employees when they turned 65. In this case, you will not be penalized for not enrolling in Medicare at 65, but you will be penalized if you don't sign up during your special enrollment period. So the best time to sign up is before your current coverage ends. That way, you'll have no gaps in coverage, but you actually have a grace period of several months to avoid a late enrollment penalty. For Part B, that grace period starts the month your coverage ends and lasts for 8 months. For Part D, it's only 63 days. To summarize, you can avoid the late enrollment penalties by signing up for Medicare during your initial or special enrollment period, but to avoid gaps in coverage, which is even more important, you should sign up before your current coverage ends. And what if nobody ever told you about the Medicare enrollment periods and you didn't sign up when you were supposed to? Well, you can still sign up, but now you'll have to do it during Medicare's general enrollment period, which runs from January 1st through March 31st of each year. This is the only time you can sign up for Medicare if you are outside of your initial or special enrollment coverage. Coverage starts July 1st, so as you can see, this could leave you with some coverage gaps, so you really want to avoid having to sign up during the general enrollment period, but it may be the only option for some people. The important thing to know is that you can't just sign up for Medicare as soon as you realize you failed to do so. So if you're outside of that general enrollment period, you have to wait until the next one rolls around. All right, let's do a quick review of Medicare enrollment periods because this is important. The initial enrollment period is for everyone age 65 who is not covered by an employer group plan that covers 20 or more employees. The best time to sign up is the 3 months before you turn 65, your 65th birthday, and Medicare coverage will start on the first of the month that you turn 65. The special enrollment period is for everyone over 65 who is covered as a current worker or a spouse of a current worker under an employer group plan that covers 20 or more employees. The best time to enroll in Medicare is before that coverage ends. Then your Medicare coverage will start on the first of the month of enrollment. The general enrollment period is for people who did not attend this webinar and didn't know that they needed to sign up for Medicare during their initial or special enrollment periods. They can sign up between January 1st and March 31st of each year with coverage starting on July the 1st. So, how do you sign up for Parts A and B? It's actually really easy. As I mentioned, if you are already receiving Social Security when you turn 65, you'll be automatically enrolled in Medicare. If not, you can go to ssa.gov, click on Medicare, and then click on the big Apply for Medicare Benefits button. Or you can do it by phone by calling Social Security at the number that you see there, 800-772-1213. Part D isn't quite as straightforward because first you have to decide what you want your prescription drug coverage or how you want your prescription drug coverage, whether you want a standalone prescription drug plan or a Medicare Advantage plan. In either case, you'll be shopping for plans offered by private insurers. Once you've decided on original Medicare versus Medicare Advantage, and then choose a specific plan, you can enroll in Part D through the insurance company or through Medicare. And then this brings us to Part 2, Medicare and private insurance. This pie chart shows the breakdown of spending by the average Medicare beneficiary for premiums and services. Almost half of spending, or about $2,294, is for insurance premiums, while $3,166 is spent on services, including long-term care. Total out-of-pocket spending by the average Medicare beneficiary is a little under $6,000. These figures are for 2016, which is the latest information available. Focusing on the out-of-pocket costs paid by Medicare, they fall into two main categories: premiums and out-of-pocket costs. Monthly premiums are paid to Medicare and to the private insurance companies offering the drug plans and Medigap policies or the Medicare Advantage plan. Out-of-pocket costs include deductibles, the portion of the doctor bills not paid by Medicare, and the services not covered by Medicare. First, let's look at the monthly premiums. Part A is free if you or your spouse has paid into Medicare for over 10 years. This is the one reason most people sign up for A when they turn 65, even if they're covered by an employer group plan. It doesn't cost anything. Part B is different though. It costs $144.60 per month in 2020. Now the Part B premium is adjusted for inflation, so it might be higher next year. Also, higher income beneficiaries will pay more. The Part B premium is paid to Medicare. Part D premiums vary depending on which plan you choose. And the Part D premium is paid to private insurance company whose drug plan you end up choosing. Now this table shows the Part B and Part D premiums for the different income levels. This is really important to pay attention to. If you're single and your income is under $87,000, or if you're married and your income is under $174,000, you're going to pay the regular Part B premium of $144.60 per month. And that's per person, okay? So if you're married, double it. There'll be no income-related adjustment. Your Part D premium is going to vary, of course, but if you pick a plan that charges the average premium, you're going to pay about $40 a month for a total of $184.60 per month. for Part B, and then of course for Part D coverage. If your income falls into one of these other tiers, you can pay an income-related adjustment on top of the base premium. So for example, if you're in the second tier, you're going to pay an extra $57.80 for Part B and $12.20 for Part D on top of your regular premiums. So this will bring your total up to $254.60 per person per month. Keep in mind that these are per person, just as I mentioned. So if you're a couple, go ahead and double these amounts. Now, your tax return from 2 years ago is going to be used to determine this income-related adjustment. For example, the adjustment for 2020 is going to be based on the income that you reported on your 2018 tax return. So you really need to be careful once you retire to monitor your cash flow income. If you decide to take a large distribution from your IRA, you may be bumped into a higher income tax bracket and in one of those different tier groups and end up paying that higher premium for the following year. This can also be a challenge if you have a large IRA and you find yourself having to take required minimum distributions. You should examine this well in advance as it pertains to you. There may be ways prior to minimize or avoid paying the higher premium. But in all of tax planning, there are always things you can control and things you cannot control. But you owe it to yourself to examine all your options, do some planning, make wise choices, and control the things that you can control. Also, keep in mind that premiums shown here do not include premiums for Medicare Advantage or Medicare supplemental plans. This is for Part B and Part D only. So in our cash flow analysis for our clients, we examine this income and we ascertain if taking a required minimum distribution is going to bump that individual up. We kind of project that out 2, 3, 4, sometimes 5 years in advance. It allows us to do planning well ahead of time. So it's important to do that type of planning. That way you have your eyes wide open, you got the right expectation, and you don't have any unpleasant surprises. Okay. In addition to premiums, there's going to be some out-of-pocket costs under Medicare. So if you have to be hospitalized, the first $1,408 in hospital costs is going to come out of your own back pocket before Medicare starts kicking in. Some private insurance plans cover this, as we'll see in just a moment. The Part B deductible is a reasonable $198 per year, and this is waived for some preventative services such as flu shots and certain screenings. The Part D deductible is $435 per year under the standard Medicare design, but Part D coverage is quite complicated, as we're going to examine in just a moment. So after you've met your deductibles, there are some other costs. Medicare doesn't pay your entire medical bill. So if your hospital stay exceeds 60 days, you'll be responsible for $352 per day up to the 90th day, and then $704 per day up to the 150th day. After that, you'll pay the full cost. Medicare pays the full cost of 20 days of skilled nursing care. After that, you'll pay $176 per day for 21 through 100 days. So if you need more than 100 days of skilled nursing care, you're going to have to pay the full cost out of pocket. As for Part B, your responsibility is 20% of the Medicare approved costs. Doctors who accept assignment agree to be paid directly by Medicare and will not bill you any more than the Medicare approved amount. Doctors who don't accept assignment may charge more. If they don't charge more than 15% over the approved amount, Medicare will pay 80% of the Medicare approved amount, and you'll be responsible for the rest, the 20% plus the 15% over. Under the standard drug plan design, the beneficiary pays a $435 deductible, then 25% of drug costs after that deductible has been paid. Then there is a small copayment once out-of-pocket spending has reached $6,350. But drug plans vary widely. Some are going to pay more, requiring you to pay less. It will be important to find a plan that covers the drugs you take. After looking at all of these out-of-pocket costs that you have to pay, you might be wondering what Medicare does cover. Well, It covers the first 60 days of hospitalization, minus the deductible, of course. It covers 80% of your doctor bills, and it covers some preventative services. The best reference for finding out what Medicare covers is the Medicare and You book. To get it, you can call the 800 number there on the screen, or you can go to medicare.gov and you can download it into a PDF format. You can also call our office and request it from us, and we can email it to you as well. The Medicare and You booklet spends over 20 pages talking about what Medicare covers and only one page talking about what it doesn't cover. So I'm not talking about partial payments, I'm talking about no coverage whatsoever for the list of services that you see here on your screen. Now, some of these things you can avoid. Cosmetic surgery is optional, for example. If you never go outside the United States, you don't have to worry about that. But some of these other things may be necessary. Dental work, eyeglasses, hearing aids, these are all things that you're going to have to cover yourself. And this is where private insurance comes into play. Private insurance can cover all or part of your deductibles. Those hospital costs after 60 days and the 20% of doctor bills that Medicare doesn't pay. And of course, all prescription drug coverage is offered through private insurers who contract with Medicare. Medicare alone doesn't cover them. Depending on the drug plan you choose, it may cover the deductible, and it should cover most of the cost of certain drugs during the initial benefit period and the catastrophic coverage period. But it won't cover all drugs. So each plan has its own list of drugs called a formulary, and it won't cover much, if anything, in the donut hole. Medicare supplement insurance, commonly called Medigap policies, are issued by private insurance companies, and they're designed to fill the gaps that Medicare doesn't cover. Although they're not affiliated with Medicare, they do have to follow certain federal and state laws designed to protect you. Medigap insurance policies are standardized. They're identified by the letters A through N. So if you buy a Plan F in California, it will offer the same benefits as Plan F in New York. However, the premiums can vary considerably from company to company and from area to area. For example, in one Florida county, the monthly premiums for Plan F range from $192 to $465 per month for the exact same policy. That's why it's so important for you to carefully evaluate your Medigap insurance and not pay too much for it. Definitely want to go with a reputable insurance company though. This table shows the various benefits for the various plans. This is in the Medicare and You booklet, so you don't have to memorize it. The main thing to remember is that when you're looking at a particular plan, it will be the same as every other plan offered by other insurance companies. So you'll want to make sure you don't overpay for the same policy you can get elsewhere for less. Medicare Advantage plans, also called Part C, are offered through private insurance companies that contract with Medicare. Medicare pays an amount to the plan for each member's care, and the plan is responsible for providing the care. You may have to use that network's doctors or hospitals, so you'll want a plan that includes prescription drug coverage, and you may even be able to get extra benefits like vision care. But the benefits and cost sharing for Medicare Advantage plans are different than for original Medicare. So again, you'll need to shop carefully and choose a plan that is going to fit your needs. And this is just a reminder, once again, to shop carefully for private insurance. Medigap policies are standardized, but the premiums vary considerably. First, choose a plan that offers the coverage you need. Plan F is the most comprehensive plan. Then choose a reputable company offering that policy at the lowest price. And before signing up, check with your provider's billing department to make sure that they process the billing for the company you choose. Otherwise, you'll have to pay the bills yourself and then file a claim to get reimbursed by the insurance companies. You don't want to do that. Drug plan benefits vary considerably. So if you don't take any prescription drugs at present, you can choose the cheapest plan available. You can always switch to a more comprehensive plan later. So if you do take prescription drugs, you'll want to examine each plan's drug list to see what kind of coverage is provided for the medicines that you take. And same with Medicare Advantage plans. Make sure you evaluate each plan's offerings and costs. Make a clear choice about which private insurance to go with. And that brings us to part 3, planning for higher healthcare costs in retirement. So here's a look at healthcare spending by gender and by age group. Women, of course, tend to spend more than men on healthcare, and older people spend more than younger people. A large part of these higher expenses later in life are ultimately for long-term care type services. So here's what a typical Medicare budget might look like today, considering premiums only. The Part B premium is $144.60. The Medigap premium is about $200, and the Part D premium is about $40, so that brings you to a total of $384.60 per month per person. Now, considering both premiums and out-of-pocket costs, the typical healthy Medicare beneficiary might spend over $6,000 per year in premiums, non-covered prescription drugs, and other out-of-pocket costs for dental, vision, and of course, alternative care. What can cause your healthcare budget to change? 2 things: inflation, and of course, the possibility of getting really sick. As healthcare costs continue to rise, insurance premiums go up, and the non-covered services that you pay for yourself get more expensive. If you get sick, you may need more expensive prescription drugs and have to spend so much that you find yourself in the donut hole, having to pay many thousands of dollars a year for your medications. And there's always the possibility that as you age, you'll require more non-covered services like major dental work, hearing aids, or long-term care. Here's a slide that won't encourage you very much. How can you plan for rising healthcare costs when you might be on a fixed income when you retire? One way is to set aside enough funds to cover your future healthcare costs before you retire. Fidelity does a study every year to determine how much the average couple might need at the start of retirement to fund all their future healthcare costs, not including long-term care. They say the average couple will need about $285,000. The Employee Benefit Research Institute did a similar study with slightly different variables and came up with $144,000 for men and $163,000 for women. And of course, this adds up to $301,000 for couples. But these are just the averages. So if you live longer than the average life expectancy, or if you have different healthcare needs, you might need more. And remember, these amounts do not include long-term care. It can get surely expensive. How many of you know someone who got old and needed long-term care? We're not necessarily talking about nursing home care. Long-term care can range from someone coming to the home for a few hours a week to help with meal preparation to skilled nursing care. The important thing to know is that Medicare and Medigap do not cover long-term care. The most comprehensive Medigap policy pays for 100 days of skilled nursing care only. But if you're not sick enough for skilled nursing care, they're not going to pay for it. So the average period of skilled nursing care is just 28 days. And when it comes to custodial care for help with activities of daily living, there's no coverage at all. So it wasn't surprising that 100% of you who took the Medicare survey are concerned about healthcare expenses in retirement. Really important issue. Now, before you say, I'll never get old and need help, consider this. 35% of people over 65 have activity limitations. Some of them need help with the so-called instrumental activities of daily living, which includes things like shopping and cooking. Others need help with things like bathing and dressing. Here we see the causes of activity limitations for people over 65. More than half of this population suffers from hypertension, and nearly that many deal with arthritis. And these numbers take into account a wide age range. So we know that these conditions usually get much worse as the older you get. When you're healthy and active in your 60s, it's hard to imagine not being able to bathe or dress yourself. But it's just a fact of life that people need help as they get older. Nearly half of all people over age 85 have some difficulty walking. And this in itself can limit the things you do for yourself. For most people, the need for long-term care is very gradual. You start out needing help with shopping, preparing meals, doing housework, managing money, and traveling. This level of care is often provided by a family member or a paid housekeeper. Then you get to where you have difficulty with these essential activities of daily living: eating, bathing, dressing, going to the bathroom, transferring from chair to bed, and maintaining continence. I know nobody likes to think about these things, and I don't either, but we all know of people who have needed this type of custodial care. The third level of care is called skilled nursing care. This is care provided by a licensed nurse for a medical condition or a rehabilitation. Sometimes this level of care is short-term, and if you need it for 100 days or less, Medicare and Medigap might pay for it, depending on which Medigap policy you have. But sometimes skilled nursing care is needed for a longer period of time, and then the cost can become burdensome. So, how much does long-term care cost? Well, it varies with the type of care, of course. This Genworth annual cost of care survey shows us the median costs across the United States. Homemaker services cost about $141 per day, and home health aid services about $144 per day. Adult daycare costs about $75 a day on average. However, it can range from $15 to $160 per day. Residents in an assisted living facility can range from $2,000 to $7,000 a month, depending on the location and amenities. The median monthly rate is about $4,000 per month. The most expensive type of care, of course, is in a nursing home, where residents can get skilled nursing care. A private room ranges from $200 a day to $1,000 a day. The median daily rate is $280. 1 year at this rate, and you're spending over $100,000. Now, none of us want to think about getting old and needing long-term care, but there are some very compelling reasons why we need to. One is to spare your kids or other family members the burden of taking care of you. They might not mind doing the shopping or paying your bills, but if you were to need constant supervision or help with bathing and dressing, that's beyond the call of duty for even the most devoted son or daughter, if they're even able to do it. Another reason to plan for long-term care is to avoid having to spend down your assets in order to qualify for Medicaid. Now, Medicaid, this is called state-run welfare program, and it pays for your care if you don't have any money. But that's the point. You have to spend down your assets to less than $2,000 in order to qualify, essentially leaving yourself destitute. People on Medicaid don't have a whole lot of choices about the kind of care that they receive, and this is another reason to plan for your own long-term care. So to be able to direct your own care and obtain the kind of quality of care that you want. When you're paying for it out of funds that you've set aside for this purposes, or when you have insurance that is paying for it, you can decide how you'll be cared for, whether it's in your own home or in an assisted living facility of your choosing. Now, there's a lot more to say about planning for long-term care, but our time is nearly up, so I'll leave you with these 3 reminders that relate back to the 3 key points I talked about at the beginning of the presentation. Reminder 1 is to enroll in Medicare on time. Know which enrollment period applies to you, whether you need to sign up at 65 or can wait until your employer group coverage ends, and enroll when you need to in order to avoid penalties and coverage gaps. Reminder number 2 is to shop carefully for private insurance to go with Medicare. Evaluate all your options and choose the drug plan, Medigap policy, or Medicare Advantage plan that offers the coverage you need at a price that you can afford. Don't be one of those people who pay too much for private insurance because they didn't know any better. And finally, plan now for higher healthcare costs in retirement. We know healthcare expenses will be higher than they are today, so when you're planning your retirement and figuring out how much savings you're going to need to make your money last, be sure to factor in a little extra amount for healthcare, because you'll be glad that you did. Okay, that concludes our webinar today. Thank you so much for your time. If you have any questions, or if you'd like to schedule a consultation, or if you need help with your Medicare planning decisions, please give me a call or email me. Our office staff will set up a time that is going to be convenient for you and I to help you with your Medicare planning decisions. Again, thanks for your time today. Be safe and have a great day.